is Kelly.Van. I'm a candidate from the British School of Beijing in China. The paper I'll be presenting today is titled Advance in Pathogenesis and Treatment of Parkinson Disease Based on Abnormal Accumulation of Alpha-synuclein. Before we started, let me share my screen with you. And this is my screen. So firstly, what is Parkinson's disease? Parkinson's disease is the second most common neurodegenerative disease, and it is age-related in which dopamine neurons in substantia nigra of the brain gradually die over time. Parkinson's disease mainly manifests as threatening trauma, bradykinesia, stiffness, and ultimately the inability to control motor function and cause severe disability. It has now been shown that neural Lewy bodies and the intrasynaptic aggregation of alpha-synuclein are hallmark of the brain lesions in Parkinson's disease. And Lewy body lesions have been found to be present in the peripheral nervous system in Parkinson's disease. Interfering with Lewy body formation has become a hot topic in Parkinson's disease treatment. The formation of Lewy body have been linked to the transport of alpha-synuclein in brain cell and the blood-brain barrier. Nonetheless, treatment options still produce little effect. According to past investigation, this paper addressed the question of advance in pathogenesis and treatment of Parkinson's disease using literature review as an investigation method, and introduced the pathogenesis and the latest treatment strategy of Parkinson's disease based on the aspect of abnormal accumulation of alpha-synuclein, which can be provide a theoretical basis for subsequent treatment of Parkinson's disease. I know my paper is far from perfect, but I just sincerely hoping that it can contribute a little bit of my power as a biology student. Let's now begin with the section of pathogenesis of alpha-synuclein, which divided into two sections: genetic factor and alpha-synuclein and Lewy bodies. In genetic factor, SNCA was the first gene that were found to be Parkinson's disease causative gene. Some people also name it as alpha-synuclein gene, since they lead to the abnormal disposition of alpha-synuclein and eventually the formation of Lewy body. Overexpression of alpha-synuclein in mouse produced the classic symptom of Parkinson's disease. In addition, it has been shown that SNCA promoter polymorphism variants increase the risk of spreading Parkinson's disease. That multiplication of SNCA wild-type modifiers is also quantitatively associated with Parkinson's disease susceptibility. For example, additional copies of SNCA lead to earlier age of onset and more severe symptoms such as dementia. Also, mutations in the alpha-synuclein gene are only found in a smaller proportion of patients with familial Parkinson's disease. The fact that protein expressed in this gene is a major component of Lewy bodies. This suggested that it plays an important role in causing the alpha-synuclein pathogenesis of Parkinson's disease. In alpha-synuclein and Lewy bodies are one of the most common types of clumps of misfolded protein within neuron. One of its typical characteristic component is a misfolded protein called alpha-synuclein. In the nervous system, alpha-synuclein is abundantly expressed by presynaptic terminals and has multiple roles in synaptic transmission. Normal level of alpha-synuclein protect the CNS from damage. Nevertheless, increased expression of alpha-synuclein monomers in the normal human nervous system can lead to further aggregation of alpha-synuclein in oligomeric state and the development of insoluble alpha-synuclein fibers, particularly in the presence of mutation and gene duplication in SCNA. The toxic alpha-synuclein oligomer and longer fibers that accumulate in the cytoplasm of nerve cell can impair the normal differentiation of neural progenitor cell and change the differentiation from neural to glial cell, leading to a decrease in the number of normal neural cells and affecting normal neurophysiological activity. The formation of alpha-synuclein oligomers in neural cells is also likely to lead to a production of reactive oxygen species, which is an important signal for mitochondria-related apoptosis, and its increased concentration is likely to lead to a widespread neural apoptosis and impair the normal function of the nervous system. In addition, in the presence of neuroproteasomal and mitochondrial dysfunction, the rate of alpha-synuclein transport is increased, which in part creates a vicious circle of pathology and accelerates the progression of Parkinson's disease. Moreover, microglia were observed to be active when alpha-synuclein crossed the blood-brain barrier. However, it has been found that although microglia can uptake exogenous alpha-synuclein through GM1-dependent lipid RAF-mediated endocytosis, it lacks the ability of effectively degrade alpha-synuclein. This is also related to the impairment of protease system caused by alpha-synuclein. This accelerates the progression of Parkinson's disease. Now let's move to the section about the treatment for abnormal accumulation of alpha-synuclein. Currently, most treatment for pathogenesis of Parkinson's disease are still in the process of development. For example, there are no effective ways to prevent the happening of hereditary Parkinson's disease and gene mutation that trigger the abnormal accumulation of alpha-synuclein. Hence, only the strategies of various common treatment and the latest progress in the treatment for abnormal accumulation of alpha-synuclein are listed in this section. In this treatment section, I divide all the treatment into three major categories: gene therapy for alpha-synuclein targeting, and treatment for the selectively loss of dopaminergic neuron caused by the abnormal accumulation of alpha-synuclein in Parkinson's disease. This section is divided into three categories. For gene therapy to prevent the pathogenic spread of alpha-synuclein, targeting extracellular alpha-synuclein and reducing the spread of intracellular alpha-synuclein is mainly achieved by classical immunotherapy. Extracellular alpha-synuclein is used as an immunotherapeutic substrate to inhibit alpha-synuclein transmission by blocking the expression of receptors that promote intracellular transmission. Vector-based immunotherapies that deliver anti-alpha-synuclein antibody directly to the CNS via virtual vector are being explored to enhance cellular target engagement. For gene therapy to downregulate alpha-synuclein expression, alpha-synuclein target gene slicing approach ASO, siRNA, shRNA, and ZFM, using liposomal and viral vectors as delivery routes. However, downregulation of soluble alpha-synuclein expression should be first considered the minimum threshold at which alpha-synuclein can perform its normal physiological function, below which it can have potential toxic effects. For gene therapy to stabilize monomeric alpha-synuclein or accelerate the clearance of aggregate alpha-synuclein, the stabilization of monomeric alpha-synuclein or breakdown of NFTs are possible strategies to reduce alpha-synuclein aggregation. Although the main substance that stabilize monomeric alpha-synuclein are small molecules, several gene therapy candidates have emerged that they might have similar stabilizing function. For example, nanobodies designed to target the non-amyloid component of alpha-synuclein could both inhibit misfolding and accelerate clearance, thereby reducing the toxic effect in ex vivo models of synaptic nucleopaths. Apart from gene therapy, alpha-synuclein targeting is also an effective alpha-synuclein treatment. There are two main approaches to targeting alpha-synuclein: reducing its synthesis and increasing its degradation. For reducing alpha-synuclein synthesis, not only siRNA and ASO mentioned in the gene therapy section can be used to recognize small molecules binding to alpha-synuclein and prevent them from participating in the template reaction to reduce alpha-synuclein synthesis. Beta-2 adrenoreceptor agonists can also modulate transcription and reduce alpha-synuclein level, which may be a new target for the treatment of Parkinson's disease. In terms of increased alpha-synuclein, degraded alpha-synuclein is degraded via the ubiquitin protease system and the autophagy lysosome pathway. The small molecule inhibitor of the ubiquitin enzyme USP14 increase the clearance of alpha-synuclein by enhancing proteasomal activity. The mammalian target of mTOR pathway has also been implicated in the degradation of alpha-synuclein, and the mTOR inhibitor rapamycin protects neural cells in animal models. In the section of the treatment for the selectively loss of dopaminergic neuron caused by the abnormal accumulation of alpha-synuclein. Currently, dopamine receptor agonists are the most commonly used treatment for the selectively loss of dopaminergic neuron triggered by the abnormal accumulation of alpha-synuclein. It has a neuroprotective effect and plays a major role in increasing the activity of dopamine neuron. However, other normal drugs have recently been found to protect dopamine neuron, and one of the drugs is glitazone. Scientists in the UK have found that diabetic patients taking glitazone has a lower risk of developing Parkinson's disease. This is because this drug protects the neurostriatal dopaminergic neuron from neural death and has a potent neuroprotective effect against the virus mechanism involved in the progression of neurodegeneration in Parkinson's disease. However, phase 2 clinical trials have found that this drug is unlikely to alter early Parkinson's disease progression and is not suitable for further study. Meanwhile, deep brain stimulation can be performed surgically, implanting electrodes in specific nuclei in the brain to release high-frequency electrical stimulation. thereby suppressing the electrical impulse of these neurons that are overexcited due to a decrease in dopaminergic neurons, reducing their hyperexcitable state and alleviating Parkinson's symptoms. The information above shows that although all the studies indicate the treatment of Parkinson's disease had improved patient symptoms to a certain extent, they have not achieved process treatment based on specific pathogenesis. For example, the inhibition of genetic mutation that could trigger the abnormal accumulation of alpha-synuclein. Simultaneously, whilst current drug treatment become increasingly less effective over time and may eventually not be effective anymore, many novel treatments are still on their way to clinical trial. Therefore, the main challenge are to ensure the effectiveness of drug treatment while finding out more pathogenesis of Parkinson's disease. For major therapeutic research direction, technique and method that target abnormal accumulation of alpha-synuclein caused by genetic mutation and a means of inhibiting transport by targeting a protein in one of the multiple transport pathway of alpha-synuclein transport mechanism between nerve cells can all be explored in the future to achieve process treatment. Overall, thanks for listening and watching.